Hello, one and all. Welcome to Pharma Zone. I'm Dr. Sirisha. Today, we are going to discuss about antimicrobial resistance. Here, you can see antibiotic is fighting its level best with the pathogens, but at the end, either due to inappropriate use or due to wrong dosage, the microbe developed resistance resulting in wastage of antibiotic. So today's topic of discussion is wholly based on mechanism of resistance and how are you able to prevent the resistance. Why is this topic very important? As the antimicrobial resistance increases, the therapeutic options for treating a common day-to-day infection reduces. For that reason only, we should always handle antibiotics with care. Now, coming to a case study of a 28-year-old male presented with dysuria, urethral discharge, and on taking history, sexual partners diagnosed with gonococcal cervicitis, and there are no allergies associated. Based on the today's topic of discussion of antimicrobial resistance, what do you think is most important modality of treatment of this case? So, before going into the topic proper, let us first understand what do I mean by a antimicrobial resistance. Basically, antimicrobial resistance is unresponsiveness of a microorganism to an antibiotic. This can be either a natural resistance, acquired resistance, or a cross resistance. What do I mean by natural resistance? Microbes, they are already resistant to certain antimicrobial agents. The most common example for this is antibiotics like penicillin G, which are exclusively used only in gram positive organisms when they are used to treat gram negative organisms. Obviously, they don't respond. So, this is called as natural resistance and it is of not a major concern for the treating physician. Now, coming to the acquired resistance. Acquired resistance is resistance developed by an organism due to injudicial use of antibiotics over a period of time and is a big headache for the treating clinician nowadays and is a matter of concern. Here, the GIF to says you and microbe. This is actually it has a resistance pattern here. Okay, and this is being transferred to other. This is considered as one of the major mechanism for acquiring resistance. Now coming to the cross resistance. What do I mean by cross resistance is the sister products of the same group. For suppose if a microbe is resistant to erythromycin, it is always good not to use the sister drugs of the same group. This is considered because of the development of cross resistance. This is considered as a cross resistance mechanism. Now, coming to the consequences of antimicrobial resistance. Because the microbe developed resistance, what all happens? Mainly, the microbe either becomes drug tolerant, which means that high doses are to be used for the same action to be seen, or drug, drug destroying ability will be there for the microbe, or the drug to act on the microbe should enter into the microbe. That mechanism will be lost, which I mean by drug impermeability. These three are the usual consequences. Now, coming to the methods of resistance transmission. Usually, here in this figure, this shows vertical transmission. Here, let us consider that this red dots suggest antimicrobial resistant microbes. Okay, and blue dots are sensitive. What happened? Now we started giving, let us say for this colony is sensitive to amoxicillin. So we started giving amoxicillin for this group. Okay, over a period of time, all these blues will die due to a lack of resistance. But these reds, they continue to proliferate, resulting in exclusive reds. This is considered as vertical transmission, which means that the population of the resistant bacteria grows over time. Now, coming to the horizontal transmission. What do I mean by horizontal transmission is here the red one is resistant and the blue ones are sensitive to the same amoxicillin. Okay, but when we prescribe amoxicillin to this colony, usually the number of blues will reduce, but this red one, which is resistant, starts transmitting its resistance mechanisms to the other nearby bacteria. This is called as horizontal transmission. And for this horizontal transmission, the most important mechanism of resistance transfer is plasmids. So let us go into the mechanism by which this resistance develops. The most important mechanisms include mutation, gene transfer, biochemical mechanisms of resistance, prevention of drug accumulation in the bacterium. Let us start with each one. The first one being mutation. Mutation usually is a single change. What do I mean by single change is, see, let us take this sequence. In this sequence, the T here is being replaced by C. This is just an example of mutation and is considered as a single point mutation. Okay, this is the best example for mutation. It is stable and is heritable and usually occurs spontaneously and randomly. And this mutation is usually not induced by the antimicrobial agent. Okay, now coming to the second mechanism, that is genetic transfer. This is quite often seen. Here, the resistance genes are usually transferred from one bacterium to the other, and this resistance gene, let us consider this red one as a resistance gene. This resistance gene usually is an extra chromosomal DNA plasmid. Very rarely it stays as a part and parcel of the chromosomal DNA. Okay, and this extra chromosomal DNA is considered as R plasmid or R factors, and this genetic transfer of mutation, this is a transferable method of antimicrobial resistance development. So, how does this transfer happens? The first method being conjugation. What do I mean by conjugation is two bacteria, they start developing pili and the plasmid which is responsible for resistance will be transferred from one bacteria to the other. Now coming to the second one, transduction. What do I mean by transduction is here the resistance, the R plasmid transfer usually happens under the influence of a bacteriophage. Now coming to the third one, transformation, where the R plasmid is being picked up by the bacteria from the environment. These are the usual methods of genetic transfer, and this will be dealt in detail by microbiology person. Now, let us go for the next mechanism, that is a biochemical mechanism of resistance. What do I mean by biochemical mechanisms is the most commonly production of enzymes that inactivates antibiotics. The best example for this is production of penicillinase or a beta lactamase enzyme to inhibit the beta lactam drugs like penicillins. And the notorious organisms like Staph aureus, Neisseria gonorrhea, and H. influenza, they usually develop resistance by this mechanism. Modification or protection of the target site. Let us say our tetracyclines, which are basically a protein synthesis inhibitor, they should bind to 30S. If the binding site gets altered, obviously your tetracycline will not be able to bind to the bacteria. So it does not act. That's how resistance is attained. Now, in the same way, let us consider sulfonamides. Sulfonamides mainly act by inhibiting folate synthesis from PABA. So, if at all this bacteria, if they develop other mechanisms by which PABA can occur, PABA conversion to folic acid can occur, then resistance may develop. So, this is called as use of alternative pathway for metabolic growth. Now coming to the last mechanism, that is prevention of drug accumulation in the bacteria. The most and the common one is decreased bacterial cell wall permeability and is usually seen in penicillins. In the same way, active extrusion of antibiotics from bacterial cell, this includes expression of proteins and many other mechanisms. Now, coming to the extracellular degradation, this is very rarely seen. Now, as a whole, let us see to summarize the mechanisms. Obviously, decrease the penetration, permeability, or else enzymatic modification, or else target site change, or the active efflux. These all are the summary. Now let us come to the group of drugs. Till now we spoke about mechanisms only. Let us also see certain examples. Examples include drug resistance due to altered targets, mainly seen in aminoglycosides, chloramphenicol, clindamycin. Of all aminoglycosides, they do suffer from this issue. And then drug resistance due to decreased accumulation. When I talk about accumulation, it can be either reduced permeability or increased efflux. Reduced permeability is a major headache with respect to fluoroquinolones, whereas increased efflux is a major issue with macrolides. And also drug resistance due to enzymatic inactivation, this is also seen with aminoglycosides. Okay. Now, how do you prevent the antimicrobial resistance? The best method is to stop indiscriminate use as well as inadequate use or unduly prolonged use, and always use a narrow spectrum antimicrobial agent whenever possible. Always good to use a combination of antimicrobial agents. And infection by organism, which is notorious for developing resistance, must be treated intensively. And here I want to add a small point for every pharmacologist and clinician. Please don't treat viral infections with antibiotics. They don't respond. Your common cold and flu does not need macrolides. In the same way, if it is our duty to educate our patients, so how do you educate? You always think, educate the patients to ask, are these antibiotics really necessary? Or are there any other methods by which I can feel better? And does this antibiotics, do I truly suffer from a bacterial infection? And ask the patient to always complete the course and do not share your antibiotics with someone else. With this, I want to conclude. And as an add on point, I want you to understand and give two MCQs for every session I take. Here, let us discuss about this MCQ first. Widespread and prolonged use of an antibiotic leads to the emergence of drug resistant strains because antibiotics induce mutation in the bacteria. Do you think antibiotics have that ability? And antibiotics promote conjugation among bacteria. No, absolutely no. So, what is the answer? Allows resistant strains to propagate preferentially, and this is called as vertical transfer. Now, coming to the next MCQ, the following strategy will promote rather than curb emergence of antimicrobial resistance microbes. Whenever possible, use broad spectrum antibiotics. Do you think that is correct? We should actually use a narrow spectrum antibiotic always. Prefer a narrow spectrum antibiotic to a broad spectrum one if both are equally effective. obviously we should prefer a narrow spectrum so that your antimicrobial resistance chance will be very less. Prefer short and intensive course of antibiotics only when the causative organism is notorious to develop resistance. Use antibiotic combinations for prolonged therapies. Absolutely correct. The best example for this is anti-tubercular therapy. We always use anti-tubercular drugs in combination in order to prevent resistance to develop. With this, I want to conclude. Thank you for patient listening.